We got it all here, I think. Okay, so there's a bunch of stuff. Okay, it's 11:32. I mean, it's 2:32 or wherever we are, whatever time it is, it's sometime. So we have, I would like to, let me introduce myself and then AJ will introduce himself and then we could just go around the room and briefly, maybe you all could say, you know, who you are and why you're here. My name is Suzanne Gordon. I'm a healthcare journalist and researcher. I'm a co-founder of the Veterans Healthcare Policy Institute. I put down our email, our URL, and I would really encourage all of you to subscribe to our newsletter and to check out the website because it has pretty much up-to-date stuff about what's going on in the VA. We actually did a big Zoom forum, which you can find on the website on Medicare for All with Rachel Madley from Pramila Jayapal's office and some other folks. And I wrote a book called Wounds of War, How the VA Delivers Health, Healing, Hope to the Nation's Veterans, which describes the VA system, which I personally think is the best system in America. And I wish I was a vet and could get the kind of care that is delivered at the VA at its best when it's well-staffed and well-funded, which of course Congress is determined not to do. I'm a long time, single payer, healthcare reform, socialized medicine advocate. So I'm very excited to be doing this workshop. And, we also did I don't know if folks have listened in, and I don't know how you can access it, but we did a plenary session with another, a veteran who joined me from Veteran for Peace about why Medicare for All folks should care about the VA. And did any of you hear that one or okay, so I'll kind of summarize that and you might go back. And AJ, I'm very lucky to be teaming up with him for the second time. We did it yesterday. And AJ, why don't you tell us who you are?
Thanks, Suzanne. So I'm Arjun Sinha. I go by AJ. I use he and him pronouns. I'm a physician in Indianapolis, Indiana, although right now I'm in southern Indiana on the way home from vacation in Florida. I'm at my in-laws' house in their backyard. I'm a nephrologist, so adult kidney doctor, and I spend most of my time at our VA in Indianapolis, the Bush VA. And I'm on the faculty at Indiana University School of Medicine. I should mention that I'm not representing either the VA or Indiana University here. I'm representing myself. I am also part of a variety of social justice organizing groups, including Democratic Socialists of America and community mutual aid groups in Indianapolis. I'm also a member of Physicians for National Health Plan, PNHP, which has been advocating for single payer, federal universal single payer health insurance in the United States, I think since the 1980s. And that's how I got to know Suzanne. I think it was a national PNHP meeting 3 or 4 years ago. Our local Medicare for All group is called Medicare for All Indiana, and we have an Indianapolis chapter. I think I will leave it at that and allow whoever's next to talk.
Great. So how about you, Barbara?
Hi, I'm Barb Harrison. And AJ, you have a lovely cardinal singing behind you somewhere. I don't see him. I hear the song. I live in Ithaca, New York. I'm in your workshop because it's probably one of the only ones I don't really know enough about. I've been working on single payer since 2009. First in DC, and then I think I've worked with a number of state organizations, and I really have to say, I really feel that the only way to be fair is to work federally. So I think I'm gonna head in that direction. At the same time, healthcare movement is a very exclusive movement. It's maybe now beginning to want to bring people in, but the rural communities still take short shrift. I had written a workshop in 2016, which I could not get anybody interested in. They weren't interested in rural groups. They weren't interested in that. And that's the campaign, the New York campaign, the Finger Lakes group, and even the campaign. So I'm really burning out after a while. I feel like I'm talking to the wall. If you don't do the usual petitioning and lobbying and tabling, which really doesn't form relationships, so in some ways I'm throwing up my hands, but this looked interesting. So I decided the other stuff I know about, I can read. This, I felt I wanted to come to and see what you guys had to say. So thank you.
Thank you. Thank you for coming. So how about, I'm going to go down, Padma.
Hi. So I'm here because I don't really know very much about the veteran system. I hear a lot of complaining, but I also am connected here outside of Asheville to what I hear is supposed to be a really good VA. So, but I see a lot of vets on the street panhandling, and we have a local Healthcare for All Western North Carolina group, which is a chapter of PNHP. And they've sent me here, and I have learned so much today, and I'm going to bring back whatever I learned from here to that group. Thank you.
So thank you so much. And Bill?
Hi, I'm Bill Davis in Dayton, Ohio. We have a VA medical center here and on the west side of Dayton, and out towards the east, we have Wright-Patterson Air Force Base, and they have a large medical center out there. And I thought that I would, with the base being there, there are a lot of retirees from the military. They come and they, pull a trick in the Dayton area, and they like it so much that if they don't retire here, they move back from wherever they retired from to Dayton. And I think we're pretty fortunate. We've got a good VA. I'm not a veteran myself, so I can't speak from personal experience, but I thought that since we had so many veterans around here, this might be a very interesting workshop to pick up some tips on how to, or just have more knowledge about, how a single payer would affect the veterans. And I did go to a fair one summer a couple of years ago, and I talked to an old guy who was a veteran. He said, I've got my VA benefits and TRICARE, and I really don't need this. And he said, but I know there's a lot of people that do, and he signed my petition. So that made my day. Yeah,
that's great. And I just want to say to Padma, if you guys if you all would put your emails, if you're interested in the chat, because there's a great group in Asheville called the Veterans for Peace group. You're in Asheville, North Carolina, right? Is that where you are, Padma?
I know them. I'm already connected with them.
Okay, you know Bruce Crothers? Okay, great.
I know Ken Jones.
Okay, well, Bruce Crothers is fabulous. And okay, so Henry, do you want to come on and tell us who you are?
Yeah. I said I was having tech problems, but I've overcome them. So I'm Hank Abrons. I'm in Berkeley, California, and I'm here partly because I've read quite a bit that Suzanne has written, and I've actually been in the room and heard you speak, and I'm an admirer.
Oh, thank you.
I've been active in PNHP for a long time at the national, state, and the Bay Area levels. And I remember the book by Philip Longman, The Best Care Anywhere, which really opened my eyes. Right. So I'm a retired physician in pulmonary and critical care medicine, and did in my academic career, I did some attending at a VA hospital in West Virginia for a couple of years. So I'm very interested in learning more about the system, but mainly trying to understand why it's under attack and how do we defend it, and then how do we translate the lessons of the VA system to the larger discussion about national health reform.
Thank you. And Henry, I have tried to get together with you because I'm in Richmond, and can we make a date sometime soon and have a glass of wine? Or otherwise, this is my price.
We sure can. I'd love to do that, and I'd love to find a way to bring you into one of our Bay Area PNHP chapter meetings where we usually have 20, 25 people.
Yeah, that would be great.
And have you educate us more about.
Right, but let's start with a glass of wine or coffee or whatever, because we're very close to each other. And if AJ, any of you could come, but it's going to be harder for all of you. So thank you so much for being here. And it's Hank. Do you like Hank?
Yes. Okay.
And now we have Kim. Kim, you're muted, I think. Yeah.
Okay. Yeah, now I'm unmuted. Hi, I'm Kim Behrens. I am a member of the New York State Nurses Association and work at a public hospital. And I have attended other conferences where I've learned about the VA and all the news and press involved in it. I think the big concern for me is all these kind of setups that we have, or organizations, in the guise of socialized healthcare, gets butchered by the public, and just a lot of misunderstanding. So I'm here really to learn more about it and just, and get a better understanding how we can, as a single payer, system, model what the VA has.
Great. So we did a plenary, which I'm assuming you all can access, and I also put in a lot of resources there, but I want to begin, because I don't think people saw the plenary, but I want to just begin by a short little discussion of the VA and why I think Medicare for All activists must, understand about the VA, support the VA, speak about the VA. And there's, a group of very positive reasons. And then there's you just have to rebut the right-wing attacks on the VA. Because the reality is that the VA, which is the largest healthcare system in America, the only publicly funded, fully integrated healthcare system in America, which if you really want to know more about the VA, I would recommend not just Phil Longman's book, but my book, Wounds of War, because it really goes into the nitty gritty of what the VA does now and the kind of clinical care and other things that it delivers. And AJ will talk a bit more about this because he works in the VA, and he also works in the VA and then goes across the street to the private sector, and all in the same day. So I forgive, AJ, because he probably suffers from a little bit of schizophrenia here, but basically the VA is, what we call VA healthcare is the Veterans Health Administration. It's part of the Department of Veterans Affairs, which is the VA, and it is the second or third, there's debates, is it the second or third largest federal agency in the federal government, and after the Pentagon, and it runs 3 separate sub-agencies: Veterans Health Administration, the Veterans Benefits Administration, which is the largest benefit provider in the country, the GI Bill, home loans, voc rehab, a whole bunch of other stuff. And actually you have to go through the VBA often to get to the VA, compensation and pensions, for service-related problems, et cetera. And then there's the Veterans Cemetery Administration. And the big debate about privatization is in the VHA, because why is there a debate about privatization? It's because there's $90 billion out there. It's a big pot of gold. And, the Koch brothers and all these other healthcare insurance companies, et cetera, would like to get their hands on that. I mean, it's essentially what is going on with the VA is exactly what's going on with charter schools, with Medicare, direct contracting, same playbook. same argument, turn patients into consumers, turn doctors and caregivers into providers, give people choice, you know, and then you erode the public choice, right? Cannibalize money from the public sector to pay for the private sector. That's it. It's the same playbook. I mean, you can read oh God, Diane Ravitch's books on public schools and the charter school movement and just put in the VA. You know, it's exactly the same. And we should all be joined together in this. And, you know, but for Medicare for All advocates, I mean, privatizing the VA, if you think that you can get Medicare for All or single payer or any healthcare reform, if they succeed in privatizing the VA, think again. Because the VA has a huge, morally sacred, you know, kind of community fighting for it, very well organized. And they're part of the privatization problem, the veteran service organizations too, you know, because they have been impacted by this insidious, you know, turning of citizens into consumers, patients into consumers, you know, covered lives, whatever. And there's this huge amount of propaganda that's been put out there since 2014-ish, that the VA is broken. I mean, this message is carried by the Washington Post, NPR. It's not just, you know, Fox News, it's the mainstream media that has carried this message out there. And the reality is and so whenever you know, and then the right wing, when we fight for Medicare for All, I mean, all you had to do was listen to the oversight hearing the other day, you know, the House oversight hearing, and listen to these two congressmen, Byron Donalds, you know, lambasting the VA for crappy outcomes, long wait times. I mean, essentially he's describing the private sector, but he, you know, puts the name VA on it. And so my argument to single payer advocates is that you've got to know about the VA. You've got to know about the VA because it's a model for how healthcare should be delivered in this country. Yes, it has problems. Yes, it has this and that, but that's because Congress won't pay for the cost of war, right? And cost of military service. And you know, there are many single payer advocates, tragically, who, you know, associate vets with militarism. I've heard some people say, oh, the VA, we can't pay attention to that because they enable the Pentagon. Well, I mean, really, like, it is not these poor, you know, suffering vets who are the problem. It's the Pentagon. And actually, it's very interesting because the Pentagon, I think the Pentagon will be in enormous trouble if the VA disappears, because then who are you going to blame for veteran suicide? You know, I mean, right now they blame the VA. It's the DOD. It's not the veteran, you know, who are you going to blame for PTSD? Who are you going to blame for military sexual trauma? This begins in the DOD, not the VA. And, but the VA is a very convenient punching bag, right? For all the problems in the broader healthcare system. You know, why do we have delays in primary care? Well, it's not the VA's fault. They have to draw on the supply of primary care docs from the larger medical system, and we don't produce them, you know. So, but in spite of, so the VA runs the biggest healthcare system in America. You know, everybody's seen the sign, VA hospital exit here. Most people don't know what goes on in those hospitals, right? What goes on in those hospitals and medical centers, there's 170 of them around the country and 1,200 sites of care, and over 300,000 employees, have a third of whom are vets, many of whom work in the VA under what's called compensated work therapy. They will never be able to get jobs in the private sector because they're often disabled vets. And what goes on in the VA is four things. Clinical care delivered to veterans. And in the process of developing clinical care, they have models of care that are really extraordinary, team-based, collaborative, nurses have a big role, and they develop, you know, primary care-based geriatrics. I mean, and, you know, VA practically invented geriatric care. And then, you know, I'm particularly concerned with palliative end-of-life care, amazing palliative end-of-life care in the VA, because everybody's on salary. So if AJ sends a patient to a palliative care doc, it doesn't hurt his bottom line. He doesn't lose revenue. It's a revenue neutral decision. Then the second mission is teaching. VA is the hub of the American professional healthcare system. It's teaching 70% of American doctors, 55% of psychologists, nurses, et cetera. I mean, if we privatize the VA, that's real problems will ensue. The third mission is research, huge stable base of discharge to grave patients, big data, little data, whatever. And then fourth mission, which almost nobody knows about, which is to serve the nation, regions and local places in times of national emergency. Puerto Rico, during Hurricane Maria, the VA hospital was practically the only functioning hospital for all Puerto Ricans on the island. In the California wildfires, they set up command centers, and in COVID-19, they opened their units to non-VA patients. In San Francisco, we didn't have huge surges, so they didn't use it, but Manhattan, Louisiana, all kinds of places around the country, they sent VA, personnel to other places. They took over nursing homes all over the country. I mean, it's an amazing system. VA has, and AJ is going to talk to you more about this, but stellar outcomes, often better than the private sector. I would argue the VA's mental health system is the only functioning healthcare system in America, which is kind of a low bar, but and I think it's a model for healthcare, how healthcare can be delivered. Does it have problems? Yes, it's the biggest healthcare system in America. How could it not have problems? I mean, the issue isn't does it have problems, it's how does it solve the problems. It's also, and this is extremely important, the most accountable healthcare system in America. So the reason why you know about its problems is because any blip, any hiccup in the tiniest place, in the biggest place, makes the front page of the New York Times. Some itsy bitsy hospital in Roseburg, Oregon makes it to the front page of the New York Times. So the fact that, that civilian sector patients had to wait for 8 months in Burlington, Vermont, for sleep apnea studies, the New York Times does not care about that, right? And so it's accountable, it has Congress, it has the Inspector General, the Government Accountability Office, writing reports. So and if a vet has a problem getting care, they can call their congressman and get a congressional, investigation. I mean, if I have problem getting care from you, Hank, and I call, Mark DeSaulnier, who's a really nice guy. I mean, what's he gonna do? And so it's very accountable. And so it's a model, but also because it's so good, it's being attacked by the right because they want the money. Well, there's two reasons, Henry, I think, Hank. One is they want the money, and two is they cannot bear a government program that works. I mean, the Kochs want to discredit government. They don't really have a lot of financial investments in healthcare, but they want to destroy our faith in government. And so attacking the VA has done that. It has destroyed faith in government, right? And that's where, that's very important for us fighting for healthcare reform, because they use the VA, this fake news about the VA, to discredit government involvement in healthcare in any form. And we have to be able to rebut these. We have to know enough about the VA, like you guys know about, you all know, forgive me, I'm too old and I say guys, that's wrong, but you all know about Canada. You know about the NHS in Britain. You know about France. You know about Germany. You know about Switzerland. How many folks in the single payer movement, the Medicare for All movement, know what's going on in the hospital around the corner, which they're also trying to discredit to use against us. So we have to be able to know that when they say in the stupid hearing, VA has long wait times, VA has bad outcomes, somebody has to come in and say, excuse me, did you read that article in the British Medical Journal that AJ will talk to you about more, that says that if you're a vet and you go to a private sector hospital, you're 20% more likely to die in the first 30 days than if you go to a VA hospital. AJ will talk about dialysis and so forth. So we just have to know this. And it's also just so important to talk to veterans too, and to support their struggles against privatization, because veterans are, yes, a very small percentage of the community, of the national population since the volunteer army. But they are very important and trusted members of the community, and they have access to the communities that most of us, you know, liberals and progressives and socialists don't have any access to. And they have, you know, problems that we have to know about. And we also must understand, because we have to understand that the VA will not be hurt by Medicare for all. In fact, I believe that we have to argue that the VA will be strengthened by Medicare for all, because one of the main privatization mechanisms, if we have Medicare for all or socialized medicine or whatever, we eventually have, I hope, by the time I die, and I mean, you know, you and some of us gray-haired people, right, don't have that long. And we certainly want it for our children or our grandchildren and everyone else. But the main mechanism now of privatization is this VA Mission Act of 2018, which accelerates outsourcing to the private sector on the guise that it gives veterans more choice. And what the idea is that you outsource care to the private sector, but take that money from the VA and pay the private sector. So the VA budget between 2000, it's now 20% of the VA clinical care budget goes to private sector doctors. And there's this third party administrators that are private insurance companies that take a cut off every visit, you know, and so there's the middleman. I mean, it's exactly like the direct contracting entities, right, for traditional Medicare. And so basically, if you had Medicare for all, you would not have this, you know, because any vet who wanted choice, who wanted to go to a private sector doctor, it wouldn't come out of the VA. And more to the point, ineligible vets now, because not all veterans are eligible for VA healthcare. You have to have a low income and or service-connected disability and the right discharge. Because if you have a certain kind of DOD discharge, you can't get VA care. All of those people could get care inside the VA or outside the VA. Their family members who aren't eligible to get care unless they're a veteran would be able to get care. You know, these are many of the people who now join the all voluntary military come from poor communities, and they signed on because of the economic draft for healthcare and education. And they would be able to use healthcare wherever they want. It wouldn't be taken out of the VA. And I want to make a final point, because I don't think we think about this enough. But, you know, the two pillars of military recruitment in this country now, I mean, the main pillars are not, you know, go kill the bad guys or, you know, sort of patriotism, but benefits, education, free education and free healthcare. If we ever got really serious and were a really serious threat, the military would flip, because you'd be taking away one of their main recruitment tools, which is, Joe, join up because you'll get healthcare benefits. So, you know, we really have to be up on veterans in the VA. There's so many good reasons, and then we just have to fight the negative press and the negative messages. And I want to turn it over to AJ, because AJ works there every day, and he can talk to you about what the VA is like, you know, to work in and why it's so good.
I'm happy to take it from there. I would add that the way the VA is targeted is similar, like the way traditional Medicare is being targeted. Also, public schools and the post office, where the project is they defund these public goods and then say, oh, they're failing, we need to privatize them. And the same thing happens in all those examples, including the VA. I would like to make the point that the VA is, strictly speaking, socialized medicine. Suzanne has a quote, I think, of, sorry, the neighbor's dog gets riled up. I hope you can hear me okay still over the dog barking. So VA is socialized medicine. Medicare for all is, strictly speaking, it's single payer health care. It's socialized health insurance. So the government become the sole health insurer. With socialized medicine, the government is the sole provider of health care. That's what the VA is, where not only is the VA health insurer, but it owns the hospitals, owns all the equipment, MRI machines, the gurneys, the hospital beds. It also employs all the workers, so the doctors, the technicians, the nurses, etc. That's to the left of Medicare for all. If we're going to achieve, generally what happens is we're going to move the ball forward, we end up having to aim further than what we want to achieve realistically. And so protecting the VA is very important ideologically, in my opinion, because it's actually further down the road of removing profit from healthcare. Socializing health insurance removes profit from health insurance. That's what Medicare for all will do. But there's still the profit motive for doctors and hospitals and clinics. The VA removes that. There's no profit involved for the VA, which is one reason why it's great. I love working there, and I have off-the-cuff conversations with colleagues, with physicians, about why we like it. Because at the end of the day, if I work extra, so we're salaried, and if I work extra, stay late, come in on a weekend, cover for my buddy or my colleagues, and see extra patients, it's not to improve the bottom line. I don't get paid more, which is nice being paid more, but I'm not, that extra work, some kind of that isn't going to line the pockets of the CEO, the guy that owns a hospital or that owns the hospital chain, like Ascension Health. I'm sorry. So the dog's next door to me. I can go inside if that's too distracting.
It's a little distracting.
Well, my kids are inside.
I think you probably should go inside. It's kind of.
Sorry?
I think you might want to go inside because it's a little distracting.
You're also breaking up.
I can move inside.
Yeah, you are
breaking up a bit for some of us.
Okay, we'll give AJ a sec.
Suzanne, are you going to, the other thing I think that's so important to mention is buying in bulk for the drugs. And
oh yeah, you are so right. The VA, which is why the pharmaceutical industry hates the VA. The VA is one of the only systems that can negotiate drug prices with the pharmaceutical industry, and they hate that. And in fact, it's interesting because in California we had an effort, Prop 61, I believe it was, right, Hank, that was trying to get VA pharmaceutical, you know, the ability to negotiate for pharmaceuticals in public hospitals.
Privileges.
And basically what they did was they hired this vet in Sacramento to basically organize veterans against this proposition. They did the same thing with the same guy against rent control, and they organized veterans saying that it's going to hurt your VA pharmaceutical benefits if public hospitals can negotiate. It's a lie. And they were told that around rent control that you know, it would hurt homeless programs if we got rent control. So, I mean, the point is, and AJ now I think is in a better position to continue, but the point is that, you know, we cannot afford to not pay attention to the VA and to veterans.
Right.
Because they're going to be, if we don't organize them, you know, the right wing is definitely going to organize them. And they, you know, vets have a lot of, you know, moral stature in this country. And so people will listen to them. AJ, are you in a better position now?
Yep, I'll give it a try. Can you guys hear me okay now?
Yeah. Not hear the dog.
Okay. Is it, I can also, sometimes it's better if I turn off the video.
Yeah, I think you're
might be, my connection may be a little bit more stable. Let's see. So I was waxing poetic. Oh, just about the, I think it's important to keep the terms in mind, single payer versus socialized medicine. The VA is truly socialized medicine. And I think it's worth defending. In large part because it's great to work for. And like I was mentioning how, you know, we're salaried and it means we're mission focused instead of profit focused. Also, since I'm thinking about it, I'm going to just go into the outcomes. There's this idea, this meme that the VA is falling apart and that veterans all have to wait and outcomes are poor, but none of that's actually true. I think, Suzanne, you had the quote of the Republican congressman who said, you know, you guys want to pass your Medicare for all socialism. We have socialized medicine already. Or your socialized medicine, single payer healthcare. Well, we have that already. It's the VA and it's terrible. Well, first of all, Medicare for all is not socialized medicine. The VA is. Second of all, everything that congressman says that the wait times are long and the outcomes are poor, those are wrong. And we have peer-reviewed published research that shows as much. And so even the wait times, for instance, are on everyone's lips since 2014 with the Phoenix VA wait time scandal. But a study from around that time showed that the average wait times of the VA were statistically the same or no different than private wait times across the country. This is on average, of course, and the VA is the biggest healthcare system in the country. But also, since then, the VA's wait times are now actually better across the country. And this is looking across primary care. It depends on which precise study, you know, which specialties they're looking at. Primary care, ortho, cardiology, dermatology, they choose these to compare to. So VA is better than, in these communities, the VA has shorter wait times versus the outside. And then also more recently, there's a study looking at VA wait times for veterans to get healthcare within the VA versus community care, which is what it's called when the VA pays for, with the Mission Act, pays for non-VA care. And the wait times are shorter for veterans to be seen within the VA. And that it's even accounting the 6 days on average that it takes for the VA to process those community care requests. So wait times aren't, on average, for the VA are better than for veterans, or better, wait times are better in the VA than outside. And this is despite the fact Congress isn't fully funding us, the VA. But outcomes are actually a really dramatic finding. Outcomes at the VA, there's a robust body of research showing that outcomes at the VA since about 2000, so for the last over 20 years, the VA is as good or better in essentially every outcome that's looked at. And in fact, the more recent studies show the VA's, it's not just as good, it's generally better. This includes meta-analyses looking at all these, at a variety of studies, a variety of outcomes. I'm not an outcomes researcher. I do clinical research, including at the VA. But so I'm not, you know, an outcomes researcher. That's not my day job. And I happen to personally think that the metrics we use to judge outcomes for hospital systems are the best. But the ones we got say the VA is as good or better, generally better, which is really dramatic because the meme, the dogma, this idea that's out there, the zombie that won't die is that the VA is bad. Well, it's not. It's actually better. This includes like this retrospective study just published in February in the British Medical Journal, which is a top-line journal. They found that if a veteran who's both enrolled in Medicare and of course the VA has an emergency problem, needs an ambulance ride, and they only looked at veterans, they looked in areas where there's a Medicare hospital close by a VA hospital. If a veteran has to call the ambulance and end up the VA ER versus the Medicare ER, their likelihood of being dead 30 days later is 20% less. So it was close to, I think, 12% versus 9+%. It's a very dramatic change. dramatic difference. And again, I don't think that most people are aware of this. So it's not just in those outcomes, that's general outcomes. Interestingly, also the VA, when you look at hospital data, so survival after discharge, not just the ER visits, but survival after discharge, generally speaking, the VA has less mortality, in the 30 days after being discharged from the hospital. The higher likelihood of being rehospitalized, but lower likelihood of dying. That's sort of interesting because that to me suggests that maybe the profit motive is playing a role. Hospitals are now penalized for readmitting patients. But the VA is not, because we're not worried about profit. So maybe we will, if I can, before we log off, I see Padma, I see your question. I can try to hunt down the link for the British Medical Journal, or at least the author's Chan, C-H-A-N.
Yeah,
like I said, BMJ.
It's, if you look up the thing I put in, I put in a thing that's in the Washington Monthly memo to the secretary, and that's about that study, and it has links to the study, to the actual study.
Thank you.
And also
thank you.
to another study that Jan and his colleagues did that is even more interesting.
But the point I'm making is without the profit motive, we're not as worried about readmitting patients to the hospital. We'll do it if we think patients need it. And in fact, our patients live longer. they have less mortality after hospitalization. So I'm a nephrologist, I'm a kidney doctor, and so dialysis is my stock trade. And the VA data for dialysis looks quite good as well. So there's a recent study that compares veterans who get their health care within the VA versus outside the VA and Medicare. And because, by the way, Medicare covers, of course, 65 and older, but also anyone with end-stage kidney disease requiring dialysis. That's a whole other aside, but that's, as a kidney nerd, that's very much near and dear to my heart. So, turns out that if a person has newly diagnosed stage 5 chronic kidney disease, the worst it gets means dialysis is imminent, and that veteran gets their care within the VA, and compared to that veteran getting their care outside the VA. If you come back and look at them 2 years later, those veterans are outside the VA are more likely to be on dialysis. You could say, okay, it's great, the VA is keeping people off dialysis, but maybe it's the government just trying to save money by not dialyzing patients. But 2 years later, not only are veterans cared for within the VA with advanced kidney disease, not only are they less likely to be on dialysis, they're more likely to be alive. And so this, to me, again, I think it could be explained by profit motive. The non-VA nephrologists have a strong incentive to put patients on dialysis. It's much easier for us. There's less thinking, and actually dialysis is it's the lucrative. It's the procedure of the nephrologist. It's how we make our money. You can see a lot of patients in a short period of time and bill for it. So there's an incentive on the outside to put people on dialysis. And maybe if it was keeping people alive and they felt great, then that wouldn't be a problem. But it doesn't. Being on dialysis really stinks. And not only that, it's shortening people's lives. Also, if you look at the dialysis population with veterans within the VA versus outside the VA, if you look for 1 year after starting dialysis, a vet dialyzing within the VA is more likely to be alive a year later, although more likely to have been hospitalized. And so again, I think that shows it's necessary to keep people alive. And again, these are published. This is peer-reviewed, published data in major journals. Let's see. Oh, kidney higher. So it's a good question about transplants. Sort of a unique situation. So I don't know off the top of my head the transplantation data. The one problem with transplantation is not all VA medical centers are VA transplant centers. So, for instance, Indianapolis, where I work, we at the university just across the street, they do kidney transplants, but those surgeons didn't want to jump through the hoops to be designated a VA transplant center. So our Indianapolis VA patients, to get kidney transplants, have to go to Vanderbilt down in Nashville, which I just drove through earlier today, east of Pittsburgh or west of Iowa City. So I don't know how we compare transplant wise.
I can talk a little bit to that. The VA, as far as I understand, has sort of hubs that are transplant centers for different things. And I know that for stem cell, for example, there was a case where a vet in Phoenix wanted not to go to wherever it was. I can't remember where it was, but he wanted to go to a private sector, and I don't know, they let him go, and the cost in the VA was $150,000 and the cost in the private sector was $1 million. And, you know, I think one of the problems is that veterans, you know, I mean, the healthcare that the rest of us have, you have to be in network, right? And for example, in Kaiser, if you want brain surgery, you know, and you live in Chico, you're gonna have to go to Redwood City. And there's a good reason for that, because like you know, there's a volume, right? You want to go to a person who does a whole lot of, you know, cataract surgeries or brain surgeries or whatever surgery you want, and as opposed to somebody who does a few. But I think that, you know, vets are, it's hard, you know, they've been convinced that we should give them whatever they want at whatever cost, wherever. And I mean, it's ridiculous because in the private sector, I mean, I had a friend who lived in Alaska who needed a cabbage and a coronary or bypass graft. And he came to Boston on his own dime, and he had to stay with us because he couldn't afford, you know, paying $300 or whatever it was for a hotel in the Boston area. And if he were in the VA, he would have been flown to Boston or wherever, and his hotel would have been covered, and his family could have even come. I mean, you know, I think that, I just want to interrupt and see if there's any questions that you have or particular issues of concern that you would like us to address. Hank?
Yeah, I have two, but the first one is, what is the relationship for a veteran who turned 65 between veterans healthcare and Medicare?
Yeah, that's a really good question. Should I take that one first and then you can hit me with your second one, or hit us with?
I'll hold my second set until other people have had a chance, but later.
So it's very interesting. And this is something that I think Medicare would all, well, I don't know how it would work under Medicare for all. It's worth thinking about. But the VA, as I said, has eligibility requirements. Like if you have too high an income, and I mean like just average income, you know, it's really the poor and indigent. So in order to get into a high, there's 8 priority groups. You can go online and look at them. I mean, nobody can figure this out. It took me weeks to get, and I'm not even sure I can figure it out, but if you go online and look at VA priority groups, it'll explain it. But essentially, theoretically, any vet who has the right discharge can get into the VA, but practically there are priority groups. And so if you are higher income and have no proven service-connected disability, which I don't want to get into, but it's not so easy to prove it, because they don't tell service members that, you know, if you injured your knee, you know, jumping in a parachute or something, you know, you needed to go to the medic, which they, by the way, discourage you to do. So you have a paper trail. So it's really hard. It's not easy, you know, to get the service connection. And so basically, the VA can bill private insurance for non-service connected stuff for a particular vet, but it is not allowed to bill Medicare, because it's crazy. And we actually were trying to create legislation that would allow the VA to bill Medicare, because if you could bill Medicare, then you could take these who are already paying for Medicare, you could take these, you know, non-eligible priority group 7 and 8 vets and bring them into the VA, which many would love, and just bill Medicare for them. And it wouldn't cost the VA any extra money. I mean, it wouldn't cost the taxpayer any extra money. And so if you had Medicare for all, you know, you would give presumably, and I'm not an economist, so I don't know how this would work, but you could work it out so that these quote unquote non-eligible vets over 65 could go to the VA. And so and this is, I think, an argument that we should make, so that you're going to have an expansion of choices if you have, you know, this Medicare for all, because you veteran who would like to go, you know, to the VA, because the reality is, and AJ, maybe AJ, because not a geriatrician, but the reality is that the programs for older vets, I mean, you have geriatric primary care. I mean, where do you have, you know, 7,600 geriatricians in America for 330 million people. You have geriatric primary care. You have home-based primary care, largely for elderly people. You know, I try to convince my friends who are vets who are eligible, who, you know, don't think they're going to get, I don't know, they're not enrolled. And I'm like, you guys are crazy, because you know, I mean, let me tell you a story, okay? I can't resist this story. So we had a friend, he's 87. He was a big healthcare activist in California, Tom Moore. I don't know if you know who Tom was, but, and he was 87 and he had dementia and chronic obstructive pulmonary disease, COPD, very bad. And, you know, he was in Kaiser, and his wife was paying 3 days a week for daycare for him. And Kaiser was, I'm not a doctor, but I thought that they were managing his COPD really badly. Like they were sending him to the ER practically twice a week. And I'm like, that's not a plan of care. You know, an 87-year-old demented guy going to the ER twice a week or once a week or once every 2, and it was crazy. So I found out that he was a vet. He had forgotten, you know, he had served in Korean War era. He had sort of forgotten. He wasn't like, you know, it wasn't a big part of his identity. I told his wife, call the VA. Call the VA. I also called a friend of mine, his primary care. Anyway, he gets in and and they say, my friend says, oh, I shouldn't take him, you know, and he needs geriatric primary care. He gets a geriatric primary care appointment. The Kaiser wouldn't give him a hospital bed, you know, to help him, you know, when he slept to be more upright, because you have to be on hospice in Kaiser to get a hospital bed. He wasn't on hospice. VA gets him a hospital bed. VA pays 3 days a week free for his daycare, you know, free day, you know, for his respite care. And they have 10 hours of nursing care. And they were managing a COPD. And he's getting calls from my friends, calls me up, and she says, you know, this VA doctor just called me up to ask me how Tom was. I mean, when was the last time that a doctor called you up to ask you how you were? You know, it's like, really? And this is routine. I mean, I have stories like this, you know. It's just a different system, you know. It's like they have fewer patients. I mean, primary care docs in VA have 11 to 1,300 patients. There's no such thing as a 10-minute visit. I mean, they want to destroy all this, the privatizers. They want to kill it. They not only want to send folks out to the private sector, but they want to apply, you know, import the same productivity, you know, pressures into the VA to sort of, you know, but so if you could have Medicare for all, over 65 vets who want to go to the VA could go. That was a very long-winded. Padma?
So I was doing home health care in New York State at one point. Home health, hospice care. I was a nurse. And every time I had a vet and had to work with the VA doctors, it was a wonderful experience. They always returned my calls. And I got to talk to the doctor very often instead of the nurse, which, I mean, I like talking to nurses, but sometimes the doctor's the one that's going to make the order. So thank you.
Yeah, AJ, I think it would be great to hear from AJ, because, you know, what I've seen in the VA is a much more congenial relationship between physicians and nurses and doctors and staff. And also, you know, one of the big complaints in primary care that from my friends who are primary care docs in the private sector is that specialists won't call them back, you know, that, and I've never heard that in the VA. I mean, I feel that there is a much more of a community of care in the VA. AJ, do you want to speak to that? I don't know what happened.
Yeah, absolutely. So, I mean, the integration between, can you guys hear me? Oop, let me turn on my video. Can you guys hear me now?
Yeah.
Oop, I wonder, can you guys hear me?
Yeah.
Yes? Suzanne's still. Yeah, you know, the primary care physicians and the specialists like me we're all part of the same quote unquote group. So we communicate quite well. I think that doesn't really happen out on the outside, including over at the university. I should have mentioned I'm part-time VA. Most of my time is VA time, but I still spend time at the university in Indianapolis at the medical school. So that's on the private side. And it can be hard to getting a hold of primary care docs because the university only has a few primary care doctors. So most of the primary care docs for the patients that I see at the university are in a different system, and communication can be very difficult. The VA, they're all in the same system. And so I have primary care docs. I'm the section chief for the nephrology at our hospital. And primary care docs will get a hold of me with simple questions that I can answer for them and perhaps save a clinic visit for a patient. We do that all the time. And it's, again, I think largely what Suzanne likes to call having a mission focused purpose, not productivity, not RVUs for the docs out there, not making money. It's helping people out. So yeah, if a primary care doc gives me a call, or we have our internal messaging system, they send me an internal message, I'll just quickly answer their question. It could save everyone a lot of time. And that happens all the time. It happens between VAs as well.
Kim had her hand up. Kim,
Yeah, I just unmuted myself. One of the main theme that I'm hearing, and I think there seems to be a bit of a disconnect with the public. I mean, I know about the VA. I read the books, I read the research papers when I was a nursing student, and I see the evidence-based practice, that the VA employs and utilizes in care of their patients. It's all great stuff. Why is this not the argument that we use against Congress or all of these policymakers who we allow by not I don't know, we have to make a rebuttal for every case or every lie that's disseminated. I think we need to, in terms of messaging, we need to get it out there. And I guess that's really a main issue because everyone in this room right now, we're all on the same boat. We all understand. And myself as a nurse working in a public hospital that is adjacent to the VA, I hear stories, from the people that come into our emergency. I used to be a former ER nurse that come in, and the problems that I hear them not getting into the system is just a lot of little logistic things, right? But that's no different than if you have a private insurance company. A lot of it is logistics and like working around all the red tape and the loopholes that they put in. So when we talk about delays, and you cite examples of Canada, the National Health Services in England, whatever, we already have a delayed system in the commercial, insurance-based system. I mentioned it, and that's done by co-pays, deductibles and cost sharing and all that people don't understand. Yeah. So we have to get that message out there.
Well, yes, Barb.
I was just going to add, Kim, look, we have a corporate media. The healthcare movement is a very fragmented movement. You've got state here. You've got different federal, PNHP, Healthcare Now, one-payer states. You've got all these groups, and we don't speak with one voice. With a corporate media, they're not vested in getting information out. When do you ever hear information? It's so rare. Even NPR, who takes money from Chevron and Walmart, you don't hear anything. We cannot depend on the media. And we've got to go to people. And I'm a big one for storytelling, and I do have a workshop that I have to say no one is really interested in. People do not want to venture outside of their comfort zone. But if we're going to make an inclusive movement and really get to the politicians that we unfortunately have to do, we have got to have an educated public. And that means having conversations, listening, not doing presentations. And that's part of the reason people don't know anything. I live in Ithaca. They don't want to go to the rural areas. I basically will not work with them anymore. You can't use strategies, the same old strategies. It's not working. And you've got to reach out. And if we don't start doing that, guess what? We're going to we're stagnant. So,
do you want to, you had your hand up again. And Kim, do you want to take your hand down? I'm not sure how you do that, but thank you. Hank?
So this is a follow-up really to Kim's question, but my second set of questions really is, can you tell us who are the champions of the VA in Congress, if any?
Yeah.
And who are the principal opponents? And, you know, I know a little bit about this, but at this point, you know, going forward this year, how do we advocate with our federal legislators on the issues that, you know, we're learning about?
Now, that's such a good question. So the main champion of the VA has always been Bernie Sanders. And when he was chairman of the Senate Veterans Affairs Committee, he was sensational. You know, a little sadly, as he, you know, ran for president and got more involved in some other things, he slacked off a little bit, but now he's back, I think. But also Jayapal's office is very good. There's, you know, Mark, you know, there's some very good people in the Progressive Caucus. Saulnier is my congressman, Barbara Lee. The problem is that most of these Dems, corporate Dems, have, you know, bought the privatization argument for everything else, Medicare, everything else. And so you can't assume that because they're a Dem, they're on your side. And, you know, here's the thing that I think is so important. And I can't remember who said it, maybe it was Kim, but the reality is, Kim, that we have 6 people signed up to this or whatever, you know. I bet you there's more people signed up to other things, because I don't think single payer people pay attention to veterans. I really don't. I don't think they, by and large, understand the VA. I don't think they have. And I spent 2 weeks one time interviewing folks about this very issue. And they said some very interesting things. You know, one was that they were originally, when PNHP and other groups were formed, they were worried about the VA because it was socialized medicine, and and docs were on salary, and they didn't believe that, you know, that was a good political strategy. I think the situation has changed. I think, you know, Medicare for All single payer advocates have been way more tutored in, you know, Canada and other international healthcare systems, and they don't know that much about the VA. And you know, most liberal and progressive advocates are upper middle, you know, class people sometimes, and they, you know, don't know a lot of veterans, and so they don't have a reality check, and they read the corporate media. You know, they listen to NPR, and I find that scarily. You know, outside of this group, you know, many of my liberal and progressive friends, when I say I write about VA healthcare, they'll say, "Oh, are you writing an expose?" And I say, "Yeah, I'm exposing what a great system it is," because they really buy the purple Kool-Aid, which is why I'm here, you know, and why I'm imploring you. I mean, look, look at us. There's how many? 1, 2, 3, 4, 5, whatever there is, 10 of us, 6 of us, 8 of us, you know, well, that means there's 800 of us because we know 100 people that we could talk to about this. That's why we're here. We have to form a core. I think the other problem is the VA is not allowed to promote itself and hasn't promoted itself. Certainly under Trump, it didn't want to, and Obama was a terrible advocate for the VA. And then Biden's new VA secretary is promoting privatization, you know? So I think that the more we can do when we leave this session, you know, is to try to get the message out there, to try to learn more about it ourselves. And I learn more, I mean, I'm steeped in it, but I learn more about it every day, and get people like AJ and, you know, me and veterans. There's so many vets out there who can talk eloquently about this. But I think that we really need to get the message out. And Hank, the you know, as one of my friends on the Hill says, you know, many of these congressional staffers who are the gatekeepers for the senators and congressmen, they buy the purple Kool-Aid. They listen to NPR and, you know, some vet, you know, because they get all these complaints, you know, and so they have this kind of negativity bias, and it's our job, I think, you know. And the other thing I want to advise you when you're talking to legislators, this is like really important. They will say, you can go to one of these people who's just voted for this privatizing legislation, and they will say they're not privatizers. So I'm against VA privatization. And that's because they define privatization as the overnight sell-off of the whole system, right? You know, you're fired, AJ, you know, we're gonna sell the Indianapolis VA, we're gonna get rid of the whole thing. And so they can credibly argue that they're against that. But what they are for, they don't understand that privatization is a spectrum of activities. And what they're using with the VA is the salami strategy, right? And so when you talk to a legislator about privatization, I encourage people to not go in and say, I want you to be against privatization, because they'll say, oh, Hank, me, I'm against privatization. I'm on the front line, you know. You have to be very specific about what you want: funding, staffing, you know, no closures, you know, stop the outsourcing, start insourcing. We talk about outsourcing a lot. And the other thing for single payer advocates, and I have heard this, you know, there are many Medicare for All advocates, particularly docs, who say, oh, we don't need a VA, a patient's a patient's a patient, you know? I've heard this in PNHP meetings, and I'm like, I think that's what when AJ and I met, right, AJ, when we were listening to that? AJ,
that's right, yeah.
Talk about that, AJ, because that's, you know, wow, do not ever say that, you know. AJ, you want to?
Well, I mean, veterans have, of course, unique healthcare problems related to their time in the service. Like traumatic brain injury, PTSD, military sexual trauma. In the VA, although it's never been as quickly responsive as we would have liked to have been, it is, of course, the world's expert in providing care for these problems. Sorry, my son's crawling on me right now. But also the VA environment. Oh, sorry. The VA environment is unique as well. Can you guys hear me okay? Can you hear me all right? Can you guys hear me all right?
Yes.
Yes.
Sounds like you may not be able to. Okay, you can. Okay. The environment's unique. So Suzanne mentioned this earlier, but a significant portion of workers at VAs are veterans themselves. And just anecdotally, I can definitely say that for dialysis, they prefer to come have their dialysis at the VA, even if they have to drive further, for instance, because they just feel more comfortable around other veterans and who may be patients, but also caring for them. So the idea that it's just that patients are sort of just a collection of diagnoses, and and demographics is not exactly the case. We're part of the community, which this whole privatization consumer model is undermining the community aspects, the community good that is a VA or a public library or a post office or a public school.
I want to respond to Bill Davis asked, what percentage of veterans are not qualified? It's not clear. I mean, there's 19 million vets, 9 million are enrolled in VA today, 6 million depend completely on VA care, probably 11 million are eligible, maybe. And one of the things that, I believe we should all be advocating for, and particularly now, I mean, we have, particularly now because of this AIR Commission, there's this commission that is part of the Mission Act, which is essentially kind of like a hospital closing, base closing commission, and they want to close down a lot of VAs. They promised to build these fancy new, super community-based outpatient clinics, and they essentially want to destroy the inpatient care in the VA and give it to the private sector. I mean, there's so much wrong. I mean, somebody made some comment about, maybe it was in the last workshop about Congress not understanding veterans, but mostly Congress just doesn't get healthcare. I mean, they just have no idea about healthcare, which is kind of different than episodic medical appointments, so you have a huge opportunity now, because pretty much in every locale, they want to close a VA hospital. Vets are, really up in arms about this. Congress people are up in arms about this. So this is a really important opportunity for us to be able to go out to a rally and say, hey, we support you, and we're going to meet with our Congress people about Medicare for all, and we want to talk to them about, not closing VAs. And also, by the way, Medicare for all would solve some of these problems because it would take away, the incentive. So it's a very big opportunity, and pretty much, I'm certain everywhere you live. I mean, Asheville isn't on the chopping block, for example, but Fayetteville and other places are. So, Barb?
Yeah, I was going to say, the politicians, a lot of them will support Medicare for all until it comes for a vote. They'll say, oh, I support this locally, New York State, California, look what happened with 1440. But they all take money, not everyone, but many of them take money from the insurance companies and the pharmaceuticals. And this is part of the problem. Why would they understand healthcare? They have excellent healthcare. Maybe it's time. They had no healthcare for 6 months. They lived on food stamps and homeless in the street for a while. They have no connection. And I'm really serious, no connection to the common person, very few of them. It's so few of them do. All they care about is their egos and getting reelected. And I have really, that's why I believe we need to approach this so that we get to people as a moral issue, that we can see ourselves in one another. That, we have no choice with the politics, but the more people that we have that are educated, and that we can have a conversation with that don't look like us, that don't travel in the same circles, that's what's going to make a difference. We need to be an inclusive movement. Then maybe those people can go to their Congress people. And we work with people that aren't skilled, give them the support and the tools to empower themselves to find their voice. It's critical, or we're still talking to ourselves,
Well, I think you're absolutely right. And that's why we're here, to talk. Vets are part of that people. But, I also think, a lot of people say I'm preaching to the choir, and but I think sometimes the choir needs, new music. And so I wouldn't ignore the choir, and we need to expand the choir. But Bill, you have something, we do have to end, I believe, shortly. I mean, go on, and I don't really understand how this works. But I think we have to end in a couple of seconds. So I'd like Bill to be the last question, and then maybe AJ could say something, and I could say something. Bill, do you want to just say something?
The question I have is really more of a comment on what Barbara said. I mean, I agree that the people in Congress are out of touch, but I don't think it's because they have great health care. They pay premiums out of their paychecks just like every other federal employee. Now, is that correct? I think that's a common misconception.
But don't we pay their salaries? Don't their salaries come from the
I don't want to get into a, I mean, I don't want to get into a discussion because we don't have enough time to figure out how they pay for health care. But
I've been to Washington. The only thing that Congress has that any other federal employee or retiree doesn't have is a dispensary in the basement of all the congressional office buildings. They can go downstairs and, get their hangnail looked at if they want to, but everybody else has to find a doctor's office somewhere else in the city. That's all I had.
The reality is, look, we have a bought and paid for Congress, but we can make change, and we just have to organize. And I think that we have to talk. When I go into a group, I always sort of look at it, and if it's 6 people, I multiply by 10 or 20 or 100, and I say we're really talking to 600, because you talk to this one, you talk to that one. I mean, I wish there were 600 people here, but I'm ecstatic that we have the people that we have, because you are motivated, and we can all learn something from each other. And I think that we have a very apathetic population. Most people don't call their Congress people. Most people don't raise a fuss, and so I think we have this debate now. I mean, okay, maybe we'll never get it, but we've got a debate going, and that's better than 10 years ago. So I'm sort of like Gramsci, pessimism of the intellect and optimism of the will. And I think we can all really kind of, at least on this issue, expand knowledge, and also learn how to converse with people. I personally think we need to do less arguing and more motivational interviewing techniques, which is interesting. But I'd like to, my final conclusion is, look, progressives and liberals really don't understand the VA. They don't have the tools to rebut the false facts. And I think we can all collaborate to bring them and give them those tools and to expand the discussion. And I just want to give AJ the final word.
Yeah, and the good news is the data is on our side. The VA is the largest healthcare system in the country. We have reams of data going back 20 years, including very recent research showing that outcomes are better, wait times are shorter, patient satisfaction is higher, and costs are less. Literally any way you can consider examining a healthcare system, the VA outshines the rest of the country, our whole privatized system. So we shouldn't be afraid to say it. And then definitely the VA is worthy of being defended, because it's under attack, because when right-wingers try and say, we don't want to do Medicare for all, VA sucks, we can say, no, you're wrong, and this is why. It needs to be defended. I'll leave it at that.
I want to end with a funny anecdote, if they don't cut me off. I once found myself in Texas a long time ago talking about sort of socialized this and that to a group of older Republican women, very wealthy Republican women, who were sort of surprised that I didn't share their views and shocked that they had hired me to lecture them. And I was talking about, I think, healthcare, socialized medicine or something. And this one woman raises her hands and she says, "But you're talking about socialized medicine." And I said, yeah, right, I am socialized medicine. And she said, but that's socialized medicine. And I said, right, it's socialized medicine and actually better outcomes. And she said, but that's socialized medicine. She said 3 times, right? And I said, well, what's wrong with that? And she goes, well, I don't rightly know.
It's incredible.
Right, we do rightly know. So let's all, I hope we'll all see each other again. And I know you all are doing amazing work. And I really want to thank you for coming to this workshop, and thank AJ for you know, interrupting his vacation, and again, take very good care.